Hi, this is Anuj Vakil, Principal Design at Astron Healthcare. I'm going to speak today about traffic control in the hospital. Traffic, well, it's a constriction that delays every effort of the visitors in reaching its destination. An already vulnerable patient entering the hospital would only expect care to be offered to him immediately. Any delays shall only magnify his anxiety levels, resulting in the nightmares for the caregivers. Healthcare designers should preempt challenges posed by lean resources planned by stakeholders, demanding patience and longer waiting periods, another key factors for creating congestion in the hospital. Segregating the communication routes, we have four major user groups, that is patients, attendants, staff, materials. Each of them will have its own function and will demand their own way of communication so that they do not delay the other person because the priority is for them. While we talk about this, another factor that comes into play is departmental adjacencies. The essence of healthcare planning lies in juxtaposing the interdepartmental departments in the neighborhood. This results in preventing delays to care access by cutting the travel time. Proximity between the emergency and radiology, TMT and cardiologists remain the few classic examples. We talk about decentralizing common services, wherein multitasking at every patient touchpoint should be avoided so that there is easing of crowd at these nodes. Reception should only divert the patients, whereas the departmental scheduling stations should register. Pharmacists should only dispense medicines, whereas collection of cash should be left to the cashiers. Engaging the patients in an activity will always help in decongestion of spaces because what happens? We have the boredom in longer waiting time will only add to the trauma associated with the boredom. Globally recognized concepts like conducting vital parameters of the patient prior to entering the doctor's clinic suggest that the time is approaching for him to meet the doctor. Innovative ideas, well, healthcare industry is one of the industries which keeps itself abreast with the technology. This is not limited to the periodic introduction of the new equipment, but it is also in the approach of the treatment has gone futuristic. Telemedicine, teleradiology are no longer the alien words. In fact, EICU is becoming increasingly popular. Doctors sitting at one location monitors the patients at multiple locations and at times even patients at home. In either situation, the influx of human traffic within the healthcare premise remains decongested. So, in a nutshell, increasing patients in a given hospital speak volumes of the success in giving care, but it throws additional challenges at the hospital administration in controlling this higher volumes. No wonder hospital traffic is often compared with the air traffic, and the hospital administration is known as the air traffic control at the hospital. Thank you.